Hola y bienvenidos a Tu Salud, the definitive podcast for Latine and Indigenous health policy, where we talk about all things Latine, policy, and our health. I am Dr. Ceci Aquino, Executive Director at the Latino Coalition for a Healthy California. And today I am joined by the marvelous Dr. Sandra Hernandez, CEO and President at the California Healthcare Foundation. Today, we'll be talking about centering the wisdom of our communities, the life-changing power of mentorship, and the policy transformation needed to advance a sustainable health equity movement. So with that, let's get started. Muy buenas tardes, Doctora Hernández. Welcome to A Tu Salud. We're so happy to have you today.
Gracias. Buenas tardes. Un placer. I'm super excited to have a conversation with you today.
Amazing, amazing. Well, let me get started by just saying thank you for who you are. Just any space that you're in, your energy just walks before you. You have this regal energy and you're just the queen of public health and health equity. So thank you for who you are and all the work that you do.
Well, thank you. I don't really, regal, I don't know, but I'd like to think sort of humbly leaning into the things that matter for our communities, right? So that's really been who I am, what I do, what I love doing. So yeah, and I've had hopefully we'll get into great opportunities and great privilege to work in this space that we're talking about today. So thank you for that.
Oh, of course, of course. Well, to get us started in chatting about that journey, would you mind sharing a little bit with us about your personal story, who you are, what makes you you?
Yeah, thank you. Well, we come by who we are really on the generations before us in so many ways, right? And so when I grew up, when I was first born, my mother had some mental health issues. And so I spent a lot of my very early formative years with my grandmother and grandfather in a very small rural railroad town in Nuevo Mexico. And the amazing thing about that experience was really who they were as people in the community, and also just how they imparted in me how to think about walking in the world, literally and figuratively in some ways. So, neither of them had any formal education. They were all Mexicanos. They had left Mexico under different circumstances. My abuelo worked in the railroad, really as a water boy. He left Mexico when he was 12, and they found themselves in this little railroad town where again, neither of them had any formal education, but they had 10 children plus raised 2 nieces and nephews. And really, we talk about philanthropy today, but in communities, our people make room at the table and they take comida when somebody needs it, and they go to the hospital and do bedside watches at night, and they take care of little ones when someone has to go to do something else. And so, if you watch that in community, that really is what volunteering is and philanthropy is, right? In terms of what you can do and how you think. And I never, very humble beginnings, and yet I never had a deficit view, right? The physicians there would be a doctor that would come to this little town in New Mexico every other Tuesday. And so if you had a medical issue between then and the next visit, you had to get in a car and drive somewhere. So never really saw any kind of healthcare infrastructure. On the other hand, it was a rural community. So my grandma would send me to the store and say, go buy some flour and go buy this and go buy that. And she didn't give you any money. You'd go to the store. You'd say, I'm here. And they go, oh, yeah, you're Altagracia's granddaughter. Yeah, I know you. Well, that's not the flour she uses. She uses that flour and she buys that aceite. And then, she'd take out a card that said Hernández and you'd sign. And when the railroad paid at the end of the month, my grandma would go and pay all the bills. And so it was a very trusting, it was a very safe, and it had a very strong sense of community, and the way that they lived in community was like that. And really, she imparted in me, and very much a hero in my mind, and spiritually, emotionally, super supportive. And her, I remember. So I eventually came back with my parents and grew up going to school, public school in Southern Arizona in Tucson, and when I got ready to go to college, I had major imposter syndrome, I guess is what we would call it now. And I went to see my grandma, and she just reminded me that everything in the world changes. People's lives keep moving, and that there was really nothing to fear by walking into the unknown. And I think about our immigrant communities who pick up and just leave because there's this expectation that even though there's a lot of unknown, there's a lot of opportunity potentially on the other side of that. And I think that's a really important mentality for a lot of decisions that I've made, both educationally and professionally. Anyway, she and they were, they were get an education and don't forget where you came from. And you have an obligation really to make the world better than you found it. And so that really, those were the values that I have lived by. She was an incredibly courageous woman. My father developed tuberculosis when he was in the Army and was hospitalized in Denver, and she got on a train, spoke no English, got on a train, went to Denver, found her way there to visit my father, did the same on the return back. And so I think having the courage to do things that are the right thing to do was just something I had great role models for. It was true for my grandparents. It was true for my older brother. It was true for my father. My mother mother and father both worked. Um, and they were, again, very generous of money, of time, of spirit. I had three cousins that lived with us at certain times after one of my tios had a very serious accident. And so they moved back to be with us. And again, extended families are big, and we extend ourselves to be able to accommodate that. Then, just say I had great role models both in home and in family, but also in schools. And so certain people tap you and say, "Hey, did you think about this or did you think about that?" And I had many examples of that. So those were the formative years. I'm the youngest of a family of I had four older brothers. And the oldest one was 25 years older than me, and I'm the youngest of uh, of the five of us. So
Oh, the
yeah,
baby.
I was the baby. That's true. That is true. I was the baby.
That's so sweet. Oh, that's wonderful. Thank you so much for sharing that with us. I really love this. And to be honest, this pattern that keeps coming up with our guests around the strong values, that abundance mindset, right? Even though we were balancing, different socioeconomic issues, many times struggling to put food on the table, and yet we maintain, and our culture is such, is such a warm and giving culture that we, if someone has a plate of soup to eat, right, that we can always multiply it and share it with the neighbors and the rest of the family.
Yeah, I think it's a really important observation, right? That a deficiency mindset is not something that when you get into that, there's always what's missing. And I think in a cultural and valued way, the notion that there is resilience, that there is tomorrow, that you're going to have obstacles that will come at you. Sometimes you'll need others to help you, and other times you'll have an opportunity to help others, and that is sort of, for me, kind of core of community, but also in leadership development and succession planning. And I think there's an element of generosity of spirit that is beyond that builds on generosity of having plenty of soup, right? Put more water in the soup, right? And I think that's a super important theme as a community to think about. We have so many assets and so many values that are affirming to what's possible.
Exactly. And we continue to see that now, right? During the pandemic, it was communities that were getting the word out. It was that built trust and communication networks that eventually got our folks vaccinated and got them the resources they needed to stay well during a worldwide pandemic.
No question about that. A lot of our community clinics or federally qualified health centers. I came to San Francisco to do my training at UCSF. After college and after med school, um, and did a lot of work in those clinics. And so when the pandemic happened, to be able to go back there and just help with vaccines, just to get vaccines out and get the word out, and to set aside, fears and myths that were out there and misinformation out there, to really be able to, hold people in confidence and in trust and say, this is the right thing to do for you and your kids and your family. And so, yeah, super important to reflect on how community comes together, particularly under seriously adverse circumstances.
Exactly, exactly. Something that you said also resonated with me is that many of our heroes and those who inspired us in our childhood didn't have that formal education. They were educated by their experience in the world, the way that they were navigating systems, right, that weren't built for them or by them, but they were in them, and they were learning how to most efficiently and the best way to navigate them for the family, right? And to make sure that we were sharing the resources with the family and the community. And I think about the systems that we're in nowadays, and many times formal education creates a pathway, right, to break into the systems that we're trying to transform. And yet again, we keep facing this reality that our promotores, who maybe don't have that formal education, are more well versed in navigating the healthcare system that many of us that go on to grad school. And so being able to give that value where it's deserved, right? And that dignity in a different way of receiving an education.
Yeah, I think that's right. I think the word that comes to mind for me is really wisdom, right? Lived. We talked today about lived experience, and maybe we'll talk about this a little more when we talk about health equity. But that wisdom of living and what you learn from struggles is ridiculously important, right? As an asset. And so, yes, we have now in generations, largely because of what they have done to encourage us, um, now have formal education. And I think, the challenge, of course, is to go into those systems and come out and still have your values and your cultural strengths, and then be able to understand how the academic knowledge and the academic credentials can help you as a tool, not to make it who you are, but as a tool for how you continue to grow the community wisdom and change the systems for the better. And so I think it's a really important point that we acknowledge. Yes, there's learned knowledge and there's lived knowledge. And for those of us who have been fortunate to be educated, uh, uh, through formal education, academic education, to be able to recognize that both of those are needed to be as effective as you can possibly be. And one should not displace the other or overwhelm the other, right? We need to see how they complement each other to be able to move change.
Exactly. I love the way you put it. Education can be a tool, but not necessarily our identity.
That's
And
right.
And in thinking about that, would you mind sharing? So this is you growing up, and how do you transition into, your career path?
Yeah, so I mentioned I went to a very large public high school, and I played a lot of sports. I was an athlete, and the vice principal of my high school, and by the way, the high school pretty much everybody looked like me. This was a largely uh, Mexican American community, Latino community, and so. There was not a sense that there was a world that was significantly different or that you were a minority. I mean, that wasn't my lived experience. But this vice principal, who was one of the coaches that I had worked with, called me in one day and said, your parents going to let you go to college? What an interesting question, right? And my brothers had gone to the University of Arizona. My father uh, had graduated high school. My mother had gone to eighth grade, and my father and mother were very encouraging of us to go to college. I said, yes, I'm going to go to college, probably go to the University of Arizona. And he said, um, here's an application to Yale. Fill it out, and every Friday I'm going to meet with you at 8 o'clock in the morning until you submit this application. And I said, where's Yale? Because I didn't know where Yale was. And I knew it was a prestigious school, but I didn't exactly know it was in New Haven, Connecticut. And anyway, long and short of it, he was an interesting guy because his contribution as he thought about this was to put one student every year into that school. And so he, helped me suggest who should write letters of recommendation, and he reviewed my personal statement, and then a Latino student recruiter came from Yale one day and pulled me out of English class and took me to get, I don't know, lunch of some sort, and said, I got recruited by him. He puts one person every year. What do you want to know about Yale? And I thought, oh my God, this is so weird. Anyways, that's how I ended up in New Haven, Connecticut, and and then there, I continued to play sports, and there was a Latino community there from Chicago, from LA, from New Mexico, from Texas, from California. A lot of student recruitment with an effort to grow the Latino representation in that school, and so um, I had the opportunity in my second year there to be the student council for Latinos on campus, and that was, I mean, you're completely out of your culture. You're engulfed in a completely different culture, in an academically rigorous place. And, students of all stripes had good days and bad days. But it was an opportunity again to give back. I made it through the first year, so I became a counselor the second year and third year. And I did work study there and had an opportunity to work with a professor of psychology who I did work study with and who I really had a tremendous amount of respect for. And my junior year, he said to me, what are you going to do after this? And I said, I'm not really sure. And he said, you really ought to go to medical school. And I had never considered going to medical school, didn't have any role models in medicine or in science. And but I had always, my father worked as a machinist, and he and I used to play these math games all the time. He was very good at math, and we used to play these mental math games. So I took a lot of math. I had a lot of science background. I wasn't pre-med, but it turned out I had enough classes to potentially do that. Anyways, the theme there is really mentorship, right? Somebody sees something in you that you don't really know what is on the other side of that opportunity, and he, said, "Here's a counselor I want you to meet with. Here are a few classes you should take next year. You should study for the MCAT. Kind of open up a world that I, had no. I would put it this way: I was naive to, is how I would describe it, right? And that's really how I ended up in med school. And then went to med school on the East Coast again, and then really was very hungry to be back in a Latino community, to be back in community. Looked at programs all across the West Coast. I looked in New Mexico, I looked in Arizona, Texas, and ultimately, this was in the very early days of the HIV epidemic. And I had done a rotation here at San Francisco General Hospital at UCSF. And in that hospital, I could see myself as a physician. It was a place where I immediately had a sense of belonging. I immediately had a resonance with the patients that are largely served at San Francisco General Hospital. And it was, HIV was, taking people, 3, 4, 5 people a night. It was a really extraordinary setting to be at in an epidemic, but also to be at in terms of my background and what I had studied. And so I came to San Francisco in 1984 and did a primary care internal medicine residency at San Francisco, UCSF at San Francisco General Hospital. Very fortunate to match there and be able to come there. And I was super happy to leave the East Coast. And really, that was the beginning of sort of looking both at a care system that served largely our community, and to see the beauty in it and the enormous challenges in it as well. And so the anecdote I would give you there, because it was such a pivotal point for me, as an intern and as a resident, you have a primary care clinic that you do. And I had a patient that was assigned to me who was a Latina who was almost my exact age. As I remember it, we had like 3 months of difference of age. She was as old as I was. And she had polycystic kidney disease. And she didn't have documents. She had a big family. She had younger siblings who were born here. And so it was a, typical mixed family. And at the time, there was a policy that we wouldn't do dialysis except on an emergency basis. And so an emergency basis basically means that patient has to be encephalopathic from renal toxicity and insufficiency before we would dialyze her. And I saw that happen about 3 times, and I finally said, this is just not right. Like, it's not clinically right, it's not ethically right. And so I asked an attending, like, well, who makes these policies, right? And that was my foray into really health advocacy. I was post-call one day, I was in scrubs. I went to the Health Commission downtown. I signed up for public comment, 2 minutes. We do public comment. And I introduced myself. I briefly described the situation. And the chair of the commission was a physician. And he looked to the director of health and said, "Is that our policy?" And the director of health said, "I don't know." And they said, "Well, go find out." And they changed that policy. But it was the first recognition that I had, not the only, but the first really flagrant view into how historical policies get played out over a long period of time, and how within a system, whatever system you're in, you have to be able to recognize those things that are legacies of racism, of xenophobia, of homophobia, of the various ways of which we keep other people out. And that was a very powerful moment for me, because I realized that then you start to see more things, right? You see more of the things that just don't work. And that started a whole snowball for me into public health. And I was doing public health because we're still in a pandemic, and HIV was such an enormous issue. I had a brother who died of HIV disease when I was a resident. He was He had lived in New York and moved back to Arizona. And before I finished my residency, where I was taking care of AIDS patients, my brother was, suffered from a very aggressive opportunistic infection. So it was really early in the HIV epidemic. And so he didn't have any antiretrovirals. And so, that's just the message there, of course, is that healthcare is both personal, it's also systemic, right? I mean, there are systems of care, and yet you always have to be grounded in the reality of the person who's actually trying to get into care, use the care. And so my brother being sick during that time, and at the same time taking care of patients, pulled me deeper into trying to understand how communities, and in particular the Latino community, uh, began to educate and look at how a community would take care of our own. And so I finished my residency and then had an opportunity to go work at the AIDS office at the health department in San Francisco. And that started me deeper into public health and health policy.
Wow, that is so powerful. Thank you for sharing. And again, I'm so sorry to hear about your brother. My condolences.
Thank you for that.
Yeah. And, I think something that you shared around the power of being in the room, right? Many times, many of us are the first to be in the room, but it's so powerful because we don't have these blind spots that others who don't have the same experience don't recognize themselves with the patient, right? You said we were the same age and this could have been me, right? I think that thought crosses our mind, and it is so powerful and it's so needed for us to reflect those patients that we're serving and the communities and the population that our systems are meant to serve.
I think that's right. And, it's why I think in the work that you do and our colleagues in this space do, it is, we talk about how important data is and evidence is. And of course, California Healthcare Foundation spends a lot of time thinking about how to put out useful information. It's also super important to not leave out the personal stories, right? Because those are real and they are compelling and they make us have some urgency for addressing things that are longstanding. And yeah, we might not change them all overnight. We don't. I mean, um, when I first started at the General, I think the number of uninsured in California was something like 17% of the population. And today we're down to 6%, and we're in a state where people who don't have documents, it's really not an issue anymore. And that's been 30 years, 35 years in with advocates and with policymakers and with academics and with clinicians all leaning into that. And so it's just a statement about how long it can take in the journey towards health equity to be fully inclusive and make sure that everybody has at least coverage. And so, it's an important moment in time to reflect because many people don't remember when the uninsurance rate was 17%. And so I think one of the things that I want to name is how important the personal stories are and to have urgency, even though change does take time. Right, and those things live as both realities are true, right? You need to have personal stories and act and listen and hear as a way to continue the momentum and understand that these are not abstract ideas, they're not abstract theories, that the work that we're doing really does impact people's lives today.
Exactly. And to dig deeper into that impact today, we're facing the pandemic, the COVID-19 pandemic, just a couple of years ago. And unfortunately, we'll continue to face, be it the next climate change crisis or the next pandemic, whatever that is. And these systems need to reflect the changes that we need so that more and more we can be better prepared to serve communities when we're undergoing that next threat.
I think that's right. And the piece that's compelling for me, I mean, so many of the things that we did in response to COVID, we learned from the response to HIV. And so it's also important that we continue to learn both from things that worked, but also from things that didn't work, so that whatever the next population challenge or communicable disease challenge or whatever it might be takes advantage of the wisdom, right? Because going back to this notion of over time life experiences bring you more and more wisdom.
Exactly. Thank you for that. Okay, so we find you now in California. We stole you away from the East Coast and brought you to the West Coast, Best Coast. Okay, so how does that transition into, this exposure to public health and public policy, and then take you into, the foundation world and philanthropy?
Yeah, so I when I finished residency, again, someone reached out to me, someone who I have a lot of respect for, George Rutherford. He was at the time a physician. He is a physician. He's a pediatrician. He's an epidemiologist, and he was running the San Francisco Department of Public Health AIDS office. And he reached out to me and said, "Come to the health department and work in the AIDS office and help me begin to think with the community about how we were going to develop a delivery system of care once we started to have AIDS remedies." So these were the early days of the first antiretroviral, AZT. And I said to him, "George, I don't have an MPH because I'd gone to, college and med school. I had debt from school, and I didn't stop to get an MPH. I kept going just to finish." And so I said, "I don't have an MPH." He says, "There's a lot of people in my office have an MPH, but you have clinical experience doing HIV. And so come to the office and I'll teach you public health principles on the job. And you bring clinical expertise to thinking about how we were going to build out a community delivery system for HIV." I figured that was another 2 years of training, but on the job, and from somebody who was, a trained epidemiologist and a primary care physician. He was a pediatrician. I was an internist, and so um, that was an agreement. I took the job, and about a year and a half later, he went to go run the State Department of Public Health's AIDS office and said, "You should run the AIDS office now." And so there's the next job where I didn't have any management expertise because that's not what they teach you in medical school. But by then, I had done a lot of outreach into our community clinics, and I had a lot of experience by virtue of all the different advocacy groups there were around HIV. And so I got appointed to be the director of the AIDS office. These were still very early days during HIV. And, it was a city that had legislative leaders and mayors who cared about the issue. But there was also a louder voice for, you know, gay men than there were in the Latino community or in the Black community or in the API community. And so by virtue of what I had seen and learned and a lot of the in-services I had done, um, started running the AIDS office and then really started to implement a lot of public health interventions that were targeted to our specific people of color communities. And then there was leadership changes in the health department. We had a change of mayors. Director was appointed who wasn't a physician. He needed a health officer, and they approached me and said, "Will you become the county health officer?" Because I had an MD degree. By then, I had spent a fair amount of time in the health department, but that was a whole other, uh, set of public health issues and opportunities. So now you oversee, environmental health, you oversee maternal and child health, you oversee tuberculosis and STDs, and so as the county health officer, I really got to see public health in its full array of issues in a city and county of San Francisco where people actually care about public health. I used to tell people, there was no place you could go in San Francisco that somebody wouldn't stop you and say, you should do this in the STD clinic, and why are you doing that in the TB clinic, and how come you're not? And so it's a good problem, right? Because you want people to care about public health and public health policy. And so being the health officer was just an extraordinarily wonderful opportunity to both be connected to the community, but more importantly, be able to connect the community to the political apparatus. So now you're reporting to the Board of Supervisors and you're going to mayoral meetings to talk about various and sundry issues. And to me, I always felt like I was in the mortar between community and those in that apparatus. And so much of that work was about being credible in any setting you were in. So if you're going to go to Bayview to talk about breast cancer rates, you need to be credible there. If you're going to do a needle exchange program, you need to be able to reach out to the religious establishment and meet with them and get their buy-in. And so keeping in mind always this notion of, the establishment is the health commission and you're a resident advocating for a patient. And now you're in a position where you can advocate on a set of issues that impact communities and neighborhoods. And so that was an extraordinary experience and did a lot of really interesting and I think hopefully really compelling work. And I would name that again, using data, but also using kind of practical political skills. When we did needle exchange in San Francisco, we did it by declaring a public health emergency. We did that on the basis of the data. I was the health officer. I would go to the Board of Supervisors, present the evidence. They would approve a resolution, and that resolution allowed us to do things that actually interrupted heterosexual transmission of HIV in our community. We would have had so many more children and so many more women that would have been exposed to HIV if we had not done that program. And I tell you that story mainly to say that we forget the power of prevention and those kinds of preventative actions to prevent the kinds of things that could happen. And as you know, our system is not largely designed that way. The vast majority of our resources are in chronic disease management and tertiary care. And a lot of the opportunity that we have to invest in prevention, to invest in education, is constrained by resources that largely the delivery system uses. And so the pandemic, fast forward, was such an important lesson in that because the delivery system so badly needed public health to work in order for it to continue to do what it does. And so I have lived in the public health and the delivery side of it, but started in community, right? You start with family and family values. So if you go to bed at night and you think to yourself, did not just I make somebody feel better, but did I prevent somebody from having a condition that they didn't need to have, that we could have intervened in through education or screening or early intervention? And so a lot of my career has been trying to blend all of those things and opportunities together. So fast forward, I was the county health officer, and then there was another mayoral change, and the director of health, who I was the health officer for, left, and the position was open. And this is where, colleagues, friends, your support network. My comadre and I were in Mexico. We were on vacation. We'd been horseback riding. We pulled up to the place we had been staying. We went and showered. We were swimming in the swimming pool, and she said to me, "You did apply for the job, right?" And I was like, "No, I haven't applied. I'm not going to get that job." She's like, "You should just apply for the job, Sandra. The worst thing that'll happen is the commission won't hire you." I'm like, "Yeah, no, I don't think so." She's like, "What's the harm? Just submit your resume." It was the last day that the job was open for application. So I called my assistant. I said, "Just send my resume in. I'll just interview with the commission." So fast forward, that's how I became the director of health.
I love
I
it.
applied for the job. The commission hired me.
It was meant to
Uh,
be.
huh?
It was meant to be.
Yeah, it was meant to be. I think, again, this is where, encouraging each other to step into roles is such an important part of the journey. And it has been part of my journey. I always feel like it's important for people to see what these paths are and to say to folks, yeah, you don't have to have 99.9% of the requirements for the job. You have to be willing to raise your hand and say, I'll bring what I have, I'll learn, I'll put people around me that'll help me. And that's the way we get into rooms of influence.
That's beautifully said. Thank you for sharing that. I love it.
Yeah.
Okay. And then from then comes your amazing
Yeah,
entrance
then
into philanthropy.
I worked, so that was about 12 years in the health department all in. And then I got a headhunter reached out to me and said, there's a role at the San Francisco Foundation. I didn't really know what the San Francisco Foundation was. I didn't know what a community foundation was. And I was a little bit skeptical, honestly. But it was one of those things where, um, after you're in public health for a long time, you realize that all of these social determinants do add up. And I became really interested in understanding how some of those other determinants played. So, affordable housing, early childhood education, arts and cultural programming. And so, what was appealing about the San Francisco Foundation was that there was programmatic work in areas that, through my lens, were all social determinants of health. That wasn't the way the Community Foundation was framed. But as a public health, primary care clinician, that's how I saw the potential. And then it had just amazing leaders on the board who nudged, and I turned down the job 2 or 3 times, and finally they said to me, "Come for 2 years. Let's do a handshake. Come for 2 years. If you really don't like it, you can always go back to public health or whatever." And on that notion of 2 years to learn about this would be interesting. One of the board members was a very successful businessman who was a philanthropist, and he said, because I said, "Look, I did not go to medical school to run an endowment. I did not go to medical school to do fundraising. That's not what I do." And he's like, "If you're willing to learn how to run an endowment, I will teach you." So this must sound familiar to you. That's how I started at the AIDS office. George is like, "Come and do this, and I'll teach you that." And so a lot of these decisions that I've made around roles are both about what opportunity I have to make a difference, about who it is that I'm going to work with, and am I going to substantially learn something that could be valuable to things I care about. And so, on that premise and a handshake for a 2-year job, I went to the San Francisco Foundation as the first woman in 50 years. the only person of color, the only Latina, right? It was definitely one of those kinds of jobs. That was also true at the health department. First woman, first Latina. Um, and so I took that job, and most of that job I didn't know how to do, honestly. I kept a clinic at the General, kept an HIV clinic. I always had a clinic base because that's who I am, and it's in many ways kind of kept me grounded. And I had been taking care of these patients for 12 years, so I wasn't anxious to stop doing that. And so I went to the San Francisco Foundation on a handshake for 2 years and spent 12 years there. Learned a ton, worked with great people, fabulous board members, um, many examples of taking kind of my experience, my knowledge, how I've learned to work in the world, networks, like how do you connect networks? So in that waiting room could be a multimillionaire philanthropist who's trying to figure out how to do things, and sitting next to them could be a community activist who had an idea for a transgender clinic. And so in the beauty of that foundation is that you can have people like that juxtaposed to each other. And so you're trying to connect philanthropically minded people who have assets they want to put in play, and your knowledge of what's possible and who's doing work, who's doing work in the community and what ideas are coming from the community, and then trying to put those things together. And so never bored a day. It was a remarkably interesting organization, and worked with fantastic people of whom I learned both from how to run an endowment to understanding how affordable housing is paid for. I knew how healthcare was paid for, but I didn't know how affordable housing was paid for. But we had an affordable housing program, so I learned. And then the ACA passed, and when the ACA passed, I had um, the 12-year itch to get back fully into healthcare. And that's when CHCF's position became open, and headhunters reached out to me and said, "Would you be willing to come to CHCF?" And at that point, I knew the endowment, that wasn't an issue, and I knew a lot about the foundation in terms of its communications and tools. And they at that time had a very modest program on Medi-Cal, but I had seen the ACA pass. I knew that there was work to be done to improve the Medi-Cal program, which I had been working in since I came to San Francisco 30 years earlier. And I thought this is an organization that I could bring to bear on the people that are in a program for which the program has many strengths and many weaknesses, and could deploy it into areas that I care about and believe an organization like this could implement. That was more than 10 years ago, almost 11 years ago. Organization looks quite different than when I first got here. Yeah, that's how I went from being an intern to this role.
That's beautiful. That's beautiful. And I think you emphasize that serendipity of life, right? Taking the right steps, again, being guided by your values. And then the power of mentorship, especially for Latinas as women of color, many times, again, being the first in the room, but continuing to keep the door open so that more of us can come through, right? And setting the standard for those systems that Latinas and women of color are needed in those spaces.
Absolutely. I mentioned my older brother, and he was 25 years older than me. He had a lot of influence on me. He was the big brother, and I was the baby sister. And he was a big community activist in Tucson. And he told me one day, "You know what our job is?" And I'm like, "No." And he always had these somewhat sexist jokes and things he used to say. But he said, "Our job is to get inside the buildings and open all the windows and all the doors." And it's sort of it's a funny metaphor, but it's not, right. That is really the you can't just get in and settle. You can't just get in and say, "Okay, this is just fine." You have to come in and say, there's no other Latinos in this entire organization that have grant making capabilities. There's nobody, and say, well, why not? Right? Well, why not? And then build a team, and then have that team share your vision, and then slowly go about being clear about what you're trying to achieve, and recognize you can't achieve that unless you bring people who have lived experiences and have lived in different places in the state of California, and that is how an organization becomes effective and relevant, and that is really deploying assets that aren't ours, right? We're doing this on the behalf of public good, and so who is the public of California? And so, yeah, get in and open the doors and windows was one of my brother's advice. I mean, he was a Chicano activist, and there was such a large age gap that, he was doing all these things, and I was in high school playing softball, right? But he was an interesting, he was an incredible community activist. He was part of the Chicano movement, and I didn't see it all until I left for college and left for medical school and came back, and then could see, like, oh, this is what his life work had been about. And so, like, again, role models, mentorship, and and having, just don't lose track of why you do what you do.
Mm-hmm. Exactly. I really like that visual of opening the doors and the windows. I've seen it before in this image of a Trojan horse, right? We are invading the systems and breaking them and transforming them from the inside, but it means we have to get into these systems.
Yeah, I think bringing your whole self, right? I'm married to a woman. We have a beautiful 23-year-old child, and who was born at San Francisco General Hospital, and so for me, so important to connect family, friends, colleagues, the next generation of leadership of which you are. And it's so proud to see you doing the work that you're doing. So proud. Because, in back 25 years ago, there were so few Latinos in any leadership roles. And I look around today, and I'm optimistic, and I'm hopeful, and I'm proud, because I look around and see just extraordinary leadership in so many places. And so I feel like, yeah, all of us did a little bit of leadership and mentorship, and you do as many of those programs, formal, informal, but they all add up to a next generation of leadership. And I think California is well positioned in that regard.
Exactly. Well, that is a beautiful, beautiful way to end our conversation today. Thank you so much. This wisdom that you shared with us, and the powerful stories and the mentorship. We really, really appreciate you.
Thank you. Thank you for doing this. Thank you for your leadership and the work that you do. And let's keep opening the doors and opening the windows.
Así
Cuídate.
es. A tu
Nice to
salud.
talk. Salud.